but look, I guess the question is, Barry, if you don't want insurance, I mean, then what happens when you get sick? If you can't afford to get your care, should we not treat you? Is that the...
No, we purchase. I purchase insurance for my family. We're all set. We're covered. But Congressman, respect my decision to make that.
But if you made the decision not to have insurance and you get sick and show up at the hospital, what's supposed to happen? What do we do?
If I have enough money to pay my own medical, it's none of your damn business.
I don't know how much you make at what you're doing right now.
I'm not worried about me. I'm all set. We've got good insurance. My family's covered. But I don't like the government putting a gun to my head telling me that I've got to do this or I'm going to be penalized.
I'm posing a hypothetical to you. I mean, the person who chooses not to get insurance, who could very well get insurance, but doesn't get it because it's his or her personal choice. What happens when that person gets sick? Do we let them die if they show up at an emergency room?
Well, it hasn't happened yet, and we've been doing this for 50 years with the great social programs.
What happens, Barry, is they show up and they get all the care that they need because that's the way our system works. The difference is that those who have insurance have to pay for it. I don't think that that's the right way to do this thing.
All right,
I don't think the people of Massachusetts who are paying for health insurance have to pay for the uninsured in Texas and in California and in South Dakota and in Alabama and Louisiana. I mean, that's just nuts. I mean, we're paying for insurance here. One of the reasons why we're paying more and more and more, one of the reasons we're seeing healthcare costs go up, Medicare and Medicaid, is because of the uncompensated care pool, those who are uninsured. This is about changing that. And I think it's a good thing. Otherwise we have the status quo. I mean, I don't know how this.
Because you make the assumption that it's got to be either this or nothing, and there are those who believe that there are other ways to do it.
Well, do you think that the insurance companies should be able to discriminate based on pre-existing conditions?
No, come on, Congressman, I don't. But I also don't think that the government. I also don't think the government has the right to just throw the Constitution out the window and say that you have got to buy this whether you like it or not. And then I asked I asked you a question before and you wouldn't answer it. How do we enforce this? So you throw a fine at somebody if they don't pay, you're going to throw them in jail or what?
No, it's about throwing anybody in jail. You're fined. The bottom line is...
if I'm not going to get thrown in jail, I could just defy the law. No, there's no teeth to it.
I think people want to follow the law. I think people want to comply. Right. I think people understand this is a good thing.
Congressman, 35% in the best poll that I've seen support this.
You said that you think that it's wrong for insurance companies to discriminate based on pre-existing conditions. You agree with me on that.
I do agree with you on that, yes.
The question is, they can still do it.
But we don't need a multi-trillion-dollar bill that's going to put my kids and grandchildren in debt for the rest of eternity.
If you don't have a comprehensive bill, and let's say we enact something you and I just...
Well, hold on, Congressman. Because we're running very tight on time here. Why don't we have a comprehensive bill then? Why don't the Democrats, man it up and sit down at the table with the Republicans and put together a bipartisan bill?
Good question, Barry.
Well, they've been there. You guys have locked them out.
No, good question, Barry.
The president talked about hearings on television that never materialized. You guys have done this all behind closed doors.
You mustn't have C-SPAN, because there's been hundreds of hours of hearings. And I was in the Rules Committee all day on Saturday, all televised. But the reason why there's no Congress Committee is because Mitch McConnell, the Senate Minority Leader, said he would filibuster a conference.
Congressman, we have to move on. I appreciate your time. We'll go back and get this again.
I'm sorry you don't like that answer, but that's the truth.
All right, well, that's the entire reason why I'm saying I got to go. I got to hold you right there. I appreciate your time, Congressman, and we got to give the other side an equal opportunity on this issue as well, and we intend to do that. So let's head this way, and I asked Gary Best to hang on for just a couple of moments. We have with us live on the line right now Marty Lamb, who is the Republican candidate running for Jim McGovern's seat in the Congress. And Mr. Lamb, Attorney Lamb, thanks for your time. Appreciate it.
Oh, thank you for allowing me the time.
Well, what did you think of what you just heard?
Well, like the Congressman said, there's a lot of misinformation out there. And in fact, as I'm on hold, I'm Googling, and I can't find this Kaiser poll. I'd love to get the exact date and location, because I can't find any poll that shows that much support for this particular bill. In fact, from what I'm hearing on the street, just by working the street, by standing on the street, talking to people, the vast majority of Massachusetts residents that I speak to are absolutely positively against this bill.
Well, let me ask you, because Congressman McGovern makes a valid point here. He says, look, this will take the burden off of those who have been footing the bill for others for a long time, and it'll make it more equitable for everybody involved. Do you agree with that?
No, I don't.
Okay.
I don't agree at all. In fact, that was the argument made when Massachusetts passed their comprehensive health care, but yet our health care costs, our health insurance costs are skyrocketing, and at the same time, the federal government is helping bail out our plan in Massachusetts. That goes against logic to say that this will lower our cost. by adding more people onto the system. Right now, there's no denying there are problems in the current healthcare system. Insurance premiums as well as costs are skyrocketing continuously. Medicaid, Medicare are being refused by private practices because of low government reimbursement, yet they're going to cut $500 billion out of Medicaid right now under this bill. Where are the provisions in this bill to lower the costs? Provisions dealing with tort reform? I don't see any. It's going to be a costly disaster, just like the Massachusetts plan. And the rates are rising faster in Massachusetts than any other state.
What about the constitutionality of all of this? Does that concern you?
Oh, it concerns me greatly. I kept hearing the pundits say on the Democratic side, well, we can do it under the Commerce Clause. No, you can't, because we aren't allowed to have interstate commerce of insurance. You and I in Massachusetts can't buy our health insurance from a New Hampshire health insurance company. If we had interstate commerce, real free market competition, where a company could sell 50 states, then we open the borders to private enterprise competition between the different companies. We will see costs go down. We will see competitive programs. We'll see plans that are more innovative, more cost-effective, with better benefits, where people can actually shop around and say, well, gee, Massachusetts doesn't offer the portability, but this Virginia plan does. I'm going to buy that one. It will force the companies to actually give the programs that we need and that will help the American people.
Do you think this was an abuse of power?
Without question, I think it was an abuse of power. The backroom deals, the bribes that were going on right and left. It took over a year for the Democratic Party, for President Obama and the Democrats to push this bill through with a supermajority within the Democratic Party. In my opinion, if a bill has to include so many bribes to get your own team on board, there's something inherently wrong with it. And then the backroom deals, the transparency. This was supposed to be on C-SPAN. I haven't seen it.
According to Congressman McGovern, it's been hundreds of hours of it.
I'd love to see the videos of it, but every time we were asked, we asked to see it. The president promised it would be on C-SPAN. It wasn't.
All right, as a candidate for Congress, a Republican candidate for Congress, are you willing to pledge? I know there's a lot of this going around right now on the internet and the various blogs. Are you taking the pledge to work to repeal this?
I have already sent out a press release that I will pledge, and I pledge here right now on the air to do all I can to vote to repeal and to replace this plan with a free market plan that will deal with the real issues out there, the cost, the lack of, yes, people are lacking health insurance and we need to deal with that. But a number of them, if they only applied for what they're already eligible for, would have it. I think we also need to create programs for the young people that feel they don't need insurance. Maybe a young person straight out of college that's working for a living doesn't want to pay every time they go to a doctor, but they want catastrophic care. Let's create a program for them on the free market, not through government mandates. And let's take away the requirement that the government is imposing on us that you must buy insurance. Government has no constitutional right to tell me I must buy this insurance. I respectfully disagree with the congressman. He is wrong. There is no constitutional basis for that.
All right, Republican congressional candidate Marty Lamb, we appreciate your time this noontime, sir.
I appreciate you giving me the time.
All right, thank you. And we're going to go ahead straight